I'll just introduce myself. I'm Tariq Hussain. I'm a GP in Kent. I also have a role in NHS England as an Associate Dean. And Gareth, do you want to just introduce yourself?
Yeah, I'm Gareth Corbett. I'm a consultant gastroenterologist at Addenbrooke's Hospital.
So I really wanted to say, first of all, thank you to Cambridge Forum. It's been a fantastic event. Lots and lots of interesting speakers. There's a few words that I wanted to summarize that I felt that we heard today that really fit with Onion.ai. Ethical, equality, opportunity, responsibility, regulation, human-AI collaboration, and being frugal. All of these fit with what we're trying to do at Onion.ai. So first of all, I'm going to start with asking you a question. Anyone know everyone's going to know them. The Toy Story films, they're making a Toy Story 5. Does anyone know what the villain is? Who's the villain in Toy Story 5? Come on, don't be shy. Some of you must know. Huh? Sorry?
Elon Musk.
Elon Musk. Nearly. So the AI villain, hot off the press, in Toy Story 5 is Lilypad, a frog-faced tech tablet. And that really goes to show where we are with technology. Social media, I've heard it described as the poorly used AI is the junk food of the information age. Onion.ai seeks to improve health literacy, not by just giving information, but through a conversational tool, providing understanding, and that's the fundamental difference.
Thanks, Tariq. So, what is the problem?
Well, studies have shown that 30% to 87% of posts appearing on social media contains health misinformation. And what does that do? It drives poor health literacy. 4 billion people don't understand essential health information. That's according to the World Health Organization.
And of course, you then get anecdotes about the way that interactions with the internet cause trouble, and we've put a few up here. But where we're sitting at the moment is you can take a photograph of something your doctor gives you, and you can give it to ChatGPT, and it will give you an opinion back. And I've got a real example of a patient I saw. I do gastroenterology, so I look into people's gullets or into their colons with cameras. We took a picture. He put one of the pictures from his endoscopy into ChatGPT that told him he had esophageal cancer. So we then are on our phone call follow-up, and he's, Dr. Corbett, you haven't told me I've got esophageal cancer. And it becomes a very awkward conversation when it's like, no, that isn't what you've got. You've got a condition called Barrett's esophagus, which we need to treat and survey for you, but it's not that. So it's undoubted that while these tools are powerful and important, and we've got to work out how to integrate them, they're not quite there in terms of being safely used by the public. So we're going to talk a little bit about what the AI does. So if you ask a well-recognized AI tool, do you have appropriate medical training to be able to offer medical advice? The first thing it will tell you is, I don't have medical training and I can't act as a doctor. That's the AI itself telling you that. However, it will tell you that it is able to share evidence-based medical knowledge in plain language, help you understand medical terms, guide you through health literacy, and support you in preparing for appointments. But anything else, you should probably contact a health professional. It's kind of where the problem starts, though, because where we're at is that we don't have enough time with our health professionals, right? So if you go and see Tariq as a GP, you'll be lucky to get 8 minutes. And if you come and see me as a consultant, you'll be lucky to get 20 minutes. So where do you go next? Well, you can go to the impersonalized NHS website, which is an evidence-based, well-written tool, but all it does is give you an information leaflet about celiac disease or about hypertension or whatever condition it is you want to go and look up. So where do you go next to get something a bit more? Well, you could go to YouTube. It's not vetted. You could go to Reddit. It's definitely not vetted. You can scroll through videos on Facebook, where I'm watching supplement sellers all the time, aghast at the claims that they're making. I can cure your Crohn's disease, for example, or you can go to famous people that are talking about it. I would say Stephen Bartlett is one person who has said that doctors are probably going to be the last group to be replaced by AI because it's a regulated area. But there are other people not saying that, and there's disinformation everywhere. So what have we done?
So that's the problem. Now let's talk about what we've done as the solution. So Onion.ai, it's a first-in-class, personalized ecosystem. This is our front page. We look to provide health information and education and a platform driven by science fact, not science fiction. There's no jargon, there's no guesswork, no misinformation. It's evidence-based medicine, but delivered in plain language for you. We are looking not to replace the doctors, but to recalibrate the patient-doctor relationship. We're looking to try and improve health literacy so that when you go and see a clinician, you can have kind of discussions with them on that same level. The way I look at it is all my patients look things up. I fully expect it. I don't criticize them for it. But if I can give them good quality health information, we'll be able to have a discussion much more on a level. It's a world-first, peer-reviewed frame of reference tool on the assessment and management of all adult and medical surgical conditions. We, as an earlier speaker mentioned, aren't looking to use this platform for children because they're a vulnerable group, and also those with mental health. We don't think that an AI chatbot is the right place for diagnosis and management. But for all other medical and surgical, and there's plenty of them, conditions, we think this is first in class.
So that moves us on to sort of, well, what are we actually doing? So we are using a large language model, but the one that's kind of out there that you can log into and use, it relies on it. It can look at everything and anything. Whereas we've chosen to train ours on world standard medical and surgical texts. And it's a closed framework, so it doesn't go completely open source. So it's trained on stuff that we know is peer reviewed and is only from well-recognized sources. But we've done one thing more than that, which Tariq is going to explain.
So the key to our model is that if you start asking ChatGPT, should I be using more of this particular supplement, it will try and answer for you. If you say to ChatGPT, this particular supplement is great, I think it's fantastic, should I keep taking it? It'll probably say yes, whether it knows it or not. But because our information is closed sourced, is caged, we're only taking from scientific information, our model will say, there's no information on this. We don't know enough. And it's the same if someone comes to me, which they do all the time and bring their supplements and bring all sorts of things. I'll say to them, look, there isn't any medical scientific data on this kind of supplement that you're looking to take. I can't tell you whether it's going to help or not. So it will say, I don't know, no hallucinations, no unsafe guesses, just honest, clear answers. The other thing we've done in the chat is that we've created something called bot-on-bot validation. So although the chatbot is discussing with you your issues, your concerns, another bot is watching that and makes sure it doesn't give advice, it's not trying to diagnose you, it's not trying to treat you, it's just providing personalized information that's meaningful to you.
Yeah, and so what that means is that effectively you have a professor in your pocket to support and educate you with health issues, but it's not there to dictate, instruct, and offer a diagnosis. And it's very important to understand that this is not a medical device. It's not something to give you treatment advice. This is something to educate you about your health condition.
And before we move on, this section about me is information that you provide in this closed system just for you and the chatbot. And it asks questions that maybe you'll see in other places. What are your major conditions? What are your allergies? What are your medications? But some other things, lifestyle things. Your postcode affects your health. Obviously, the number of steps you take, how often do you sit? All of these sorts of elements. But because we're not diagnosing you, because we're not treating you, we don't necessarily need specific personal information about you. We don't even need your name. We don't even ask for your date of birth, just an age strata, because that's enough to start providing that level of personalized information.
So no identifiable information. Yeah. So we've done some testing. We've had 60 hours of dedicated testing on the chatbot, and everything that has come back is valid scientific content. We've made sure that there's no advice, diagnosis, recommendations. It's just talking about the facts about the conditions that people want to ask about. The plain language use has been important. The most important thing is, though, our model with its training has not done any hallucinations, which is the real key when using these AI tools, is it cannot give you an incorrect answer. And if it doesn't know, it says, I don't know.
Yeah, so when we built the model, The first thing that we did was spend a lot of time as clinicians, myself and my co-founder, really trying to train the chatbot to think a bit like a doctor does and talk a bit like a doctor does. So if you guys, you're very technological savvy, if you stick into ChatGPT, I've got back pain, please help me, it'll give you pages, 100 words easily about back pain, but it doesn't know whether you're old, whether you're younger, whether you're fit, whether you're not fit, what you've tried before. It doesn't care. It's just talking at you. You can put in those prompts and try and really kind of build up that profile, but it's actually quite difficult. So even my most literate patients struggle with that. And the pages and pages of text are sometimes sort of indecipherable. I mean, you must have all had conditions where you think, again, I'm just going to look this up. And you're reading and reading and you're thinking, is this me? Am I dying today? I really don't know. What do I do now? I have to try and see someone, but I can't see my doctor, so where do I turn? And so what we did is we built a model that straight away doesn't give you an answer. It's not saying, this is immediately the answer, you must do this. Instead, it'll start talking to you. It uses a conversational tool to build up your education. It'll say things like, tell me about your back pain. How does it affect you? When did it start? Tell me about how severe it is. And it'll even take you through very specific questions that a doctor might ask you. So at the end of the conversation, if you do choose to go and see your doctor, you're armed with the best knowledge, the best sort of answers, the best discussions to have with that clinician. This example of the chats. Yeah.
Thank you. So our last slide is about how we build and retain trust. We have a really important part of the app, which is our Learn section. And while people are having conversations, they will get signposted to the Learn section. And we've started building a group of Onion ambassadors, which are essentially healthcare professionals in senior positions across different specialties who are starting to generate educational content in plain language that's available via the platform that points people to more information. So, for example, if you're talking about chest pain and angina, we've got a video there that a cardiologist explains more about it. So you've got more interesting information to get. So it's going to essentially be packed with educational content created for learning. We're here to be educators, not influencers. As tempting as that is, it's all about making sure that it's serious content that allows people to learn about their health conditions. The app also has no gamification, no incentivation, and we're absolutely not selling medical services at all, okay? We have approached and had interest from a multitude of UK-based health charities over the time that we've been working with our project.
Perfect. Good. Thank you. So that's it. I think coming soon. We've got
Yes, exactly. So it's coming soon. If you're interested or you want to link with us, the QR code is a direct link to our
LinkedIn page.
It'd be wonderful to connect with us. I'd like to say thank you very much to EHAB for having us here today. Very, very kind to invite us to be speakers. I hope you found the talk interesting. Our vision for how to integrate AI into healthcare as a tech for good, which I guess is the real key thing here, that doesn't give people disinformation when trying to use the internet to access health information. So thank you very much.
If you want to come and talk to us, please find us afterwards. Yeah.